So the conference today is brought to you by the Research and Education Foundation from Sligo. We're a charity that's been present since 1991, and our real focus, we work with Sligo University Hospital, and our real focus is to promote research and then to share research, because there's no point in doing research unless it's brought to the healthcare workers and the healthcare scientists and actually the general public, so that it can affect what we do in research and how we behave and how we practice medicine. So these are the aims of the Research and Education Foundation. So how do we achieve our aims? I'm going to start by telling you a little bit about the REF, and then the Research and Education Foundation, known shortly as the REF, and then I'm going to tell you a little bit about the conference and why I'm so delighted that we're all here and why I think it's going to be good. So how does the Research and Education Foundation achieve its aims? Well, our first aim is to enhance research in the local region. And we do that by fostering and supporting an environment, particularly in Sligo University Hospital, that is going to allow research to happen and grow. So we've started off long before my time, the Research and Education Foundation started off doing really important things. It set up the library. I mean, you really need to have access to journals and things to begin your research. We also administer the ethics, and anybody who's carried out research in the medical arena will know you need to do ethics, so we're vitally supporting it in that way. We also provide seed grants, and we'll learn more about them anon, but basically what we're doing is supporting grassroots research and letting it happen. And actually, one of the important things about seed grants is it allows people to start out early research and get a taste for it and go on and do big things and projects and research like you'll hear about in this conference. One of the exciting things that we have coming up this year is we're going to look at a project. We're going to spend time looking at how we can develop research between the academic institutions locally, such as the IT Sligo, and the hospital, and how we can share sort of mentorship of these projects together. And by sharing mentorship, we're going to bring resources from Sligo University Hospital or our healthcare workers and the local academic institutions together to produce more research and more relevant research. So these are the kind of things that our Research and Education Foundation are doing to try and support research in this locality. As part of that, we're growing academic relationships. And this conference itself is part of that growth of an academic relationship. We have come together with members of Sligo IT and Athlone IT and healthcare workers from Sligo University Hospital. We've come together as a committee and put together this conference. So this conference, which I think you'll really enjoy, is part of that growth of relationship. As we know, IT Sligo and the other ITs are going to become universities, and IT Sligo is soon to be the Atlantic Technical University. And this is going to give us much more breadth and depth and allow us many more connections to really enhance relationships and research using them. So I'm really looking forward to that. As part of our sort of growth and networking between academic institutions, we actually have arranged a seminar, a sort of a get-together between academics at the academic institutions and our healthcare workers to produce projects, and we hope to do more of that work in the future. So we are supporting research and then trying to grow our connections so that we can actually deliver good quality research with a good academic background. But it's not important just to grow research. It's important to share our information with other people. And so that is what this conference is about. This is one of the ways that the Research and Education Foundation is sharing the research, much of which is done in Ireland, across our community and even across the water, in order that people can learn about this research. And if we learn about research, we can take ideas and do further research, but we can also apply it to our medical lives, our practice, but also to our daily lives. So it's really important. And as the Research and Education Foundation, we do conferences, we do lectures, but we also provide seminars to the general public in the Sligo region so that they can hear what's going on and they can learn and make informed decisions. And that engagement of the public is really, really important as we work together in health science. If you want to know more about the Research and Education Foundation and the charity that we are available online. If you Google REF Sligo, you will find us. That's the easiest way to tell you how to get to us. So I'm going to move on and now tell you about the seed grants. We have seed grants each year. They're supported by ourselves, the Research and Education Foundation, through the money that we've raised, and also supported by Sligo University Hospital. And these side grants are really important because, as I said, they support early research. And so we've got together as a committee and we put out a call, and a number of people have submitted applications to get support for their early research. And I'm pleased to announce that we're supporting 5 individuals as they begin their early research. And there's some really interesting projects that are going to feed into how we look after people in the future. We've got some on stroke rehabilitation, looking at exercise and applying it to stroke and rehabilitation. We've also got, in terms of stroke rehabilitation, we've got a member looking at mirror therapy and how mirror therapy can help people recover from their strokes. We've had a look, we know that with the COVID pandemic, a lot more of the clinics have become virtual, and we've had to manage things virtually. So one of our Deirdre Doherty is going to look at diabetes and the experience of people receiving online help for their diabetes. And then again, interestingly, on the digital front, we have Claude Rush looking at how can we help loneliness using digital methods. And finally, we have another interesting early research looking at how women decide what mode of birth they're going to choose. So I think these are really interesting things that are going to inform us in our healthcare, and I'm really glad that we're able to support these people. And I'd just like to say a big congratulations, because a lot of work goes into getting to the point where you can apply for a seed grant. You've had to do your systematic reviews, you've had to do your ethics, you've had to put in a huge amount of research work before you even get to this point. So congratulations to them getting to this point, but even more excitingly, I look forward to hearing what they do with their research, and hopefully maybe next year we'll hear from one of 2 of them in the conference. So I'm just going to check my time. Okay, grand. So coming to the conference, then we're going to begin in earnest in about 4 minutes' time. I think the aims of the REF really tie in with what we've learned about COVID. So the aims of the REF are about research and sharing. And actually, what have we found with COVID, but how important is research? I remember in the early days of COVID, as medics, as doctors, we were scrambling, and other healthcare professionals too, scrambling to work out how best to treat and manage this new illness. You know, we were informed by models, but they were for other viruses. And we were on WhatsApp groups. Suddenly we were all part of a WhatsApp group. And we were getting anecdotal stories, but it was very difficult to know whether these stories were real or whether the suggestions were actually effective at all. And actually it was slightly dangerous, as we've seen from some of the media suggestions from politicians across many waters. But actually, over time, evidence became really useful and really helpful as we learned how to behave. We learned that proning wasn't just an anecdotal thing, that Lyme patients on their front really made a difference to their outcomes. We learned that dexamethasone was useful and other medications were useful. And so it's helped us distinguish between what is ineffective and what is effective. I remember the day when we were questioning whether masks were going to be more of a problem because we handled them or whether they were going to be effective. But actually evidence has come to really affect how we do our medical management and how we live our personal lives. So in a remarkably short time, research has made a big difference to what we do. And by sharing that research, we've affected the health of society. And probably the biggest example of that is vaccines and the ongoing encouragement for us to use them, and the ongoing knowledge about vaccines, how they affect us, and actually more vaccines coming on board. But there's still a lot we don't know. There's a lot we don't know about the pharmacology and a lot to learn. There's a lot we don't know about the pathophysiology of COVID and its long-term effects. And there's a lot we don't know about the actions we need to take to stem the disease, or even the effect of the actions that we take. And some of that we're going to learn about today in the conference, and I'm really looking forward to hearing about it. So our conference here, what we're doing is we are sharing our knowledge, which is really important, because this knowledge that we gain today is going to affect our behaviour. It's going to affect my behaviour. You know, in the last 2 years, the investigations that I order for my patients have changed. My admission criteria have changed. My way I interact with my patients have changed. It's changed everything. In terms of Anna Ruida, she's going to talk to us later. She's one of the microbiologists. It's changed her work. The COVID diagnostics have become so important. We know that Chris McCann, who's going to talk to us later, is going to talk about digital exclusion. We've done so much more digitally, and we need to know how that's working. We need to know how we can improve it, and we also need to know how is it affecting people who are not actually digital savvy. And so those things are going to be addressed in the conference today. And also we need to know more about the effects of the disease, and we know that Prof. Liam O'Mahony is going to talk about sort of our immune system, how it affects the long-term symptoms of COVID. So I think all of these things are really going to inform us. But the bits about the way that people interact and the way we behave are important as we go back and engage with the general public. So in terms of engaging with the general public, we've got Lawrence Roop talking about their perceptions of vaccine. So it's important that we also look at people and understand and engage with the public and gain an understanding of their understanding so that we can communicate to them at their level, and also with regards to what interests them and what their opinions are, so we can actually respond appropriately. So this conference, I think, is going to bring all those aspects together. So in summary, I think we've got a really relevant conference here. We've got really exciting speakers. And of course, I forgot to mention, we've got Ronan Glynn who's coming in, and he brings together this research that we're all talking about at a national level to decide national policy. And his stuff that he's bringing to us today is going to be really recent as well, because I know he was at an EFIT meeting yesterday, so he comes with really relevant and recent information. But all of that information is based on research that's been carried out by people like ourselves and shared among us. And so that's the importance of conferences like that. So this conference, I think, is relevant, it's important, and it will affect our behaviour, and I'm really looking forward to hearing about it.